as long as you're going to be serious about it and, don't waste your time and, put your effort into it, then yeah, like you should really do it. I was like, okay. Back then money was a little tough, but it was a little hard for me. So as soon as I got my tax return, I spent everything into going to the course, travel, everything. And since then, I've never looked back.
Mm.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk, where we feature the top medical practitioners in health and beauty, both inside and out. I have Andrew Escudero, who is the founder of Dynamic Stretch Therapy in Honolulu, where he specializes in fascial stretch therapy, dolphin MPS therapy, cupping, and a range of holistic recovery techniques. He is certified in fascial stretch therapy at the Stretch to Win Institute in 2019. Since then, he's earned certifications in kinesiology taping, IASTM blading, microflossing, cupping therapy, life stretch, and microcurrent point stimulation. He's also certified by Dolphin MPS in both scar release therapy and auricular therapy, and currently completing advanced coursework in traumatic brain injury and sensory regulation. He's worked with athletes, professionals, and everyday movers to improve their mobility, reduce pain, and reconnect with their bodies. So Andrew, welcome and glad to have you here.
Thank you for having me.
Yes, let's dive into it. How did you first get interested in medicine? And but kind of before we started recording is that you had the story about you getting injured from Brazilian Jiu-Jitsu. So let's understand kind of that background and how that led you now to medicine.
So the way it began with me, like you said, Brazilian Jiu-Jitsu, a little over 10 years ago when I first started, I was always injured. Just, when you first start, martial arts, you're always careless with your body. And especially as you're younger, it's like, I'll recover. And there was this nagging injury that I had to my left shoulder. And it was really hindering movement. And it just became to a point where it's like it was constant pain. So I sought help, and it just so happened that where I was training, they would do stretching. So I was like, okay, I think I could use that. We'll see how it helps. So I got stretched out, and I was like, my shoulder feels better. And then after that, I was like, okay, can I go for more sessions? And at the time, the person that stretched me, which she does the same type of stretching that I do, she was like, it's going to be like roughly $1,000 for sessions. And I was like, I can't afford that at the moment. So then she was like, okay, my husband does this and he is way cheaper. You can go to him. So I started going to him for my therapies. And as he was talking to me, treating me, he was talking to me and teaching me. And I was like, this is interesting. I was like, it's something that I never really, thought of. He would teach me about the body, about, fascia, just a whole bunch of different things. And it was stuff that it's like, it really intrigued me. So back when I was, way younger, I was always interested in the body. So, going back to that, I was like, okay, it rekindled something in me. And I was like, I want to get into this. So down the line, like within the following 2 to 3 years, that guy, he would have courses on how to treat your body, how to fix yourself, and how to help friends and family, just for minor mobility things. I just went down a rabbit hole. I was like, okay, I want to learn how to do this, I want to learn how to do that. And I just started picking up books and and learning. So that was between 2014 to 2017. And then towards 2019, I was like, okay, I'm ready to go full on into this. So I was talking to him and I asked him, I was like, is this, like that you've been, doing body work for so long, do you recommend that I do something like this? And he's like, as long as you're going to be serious about it and, don't waste your time and, put your effort into it, then yeah, like you should really do it. I was like, okay. Back then money was a little tough, but it was a little hard for me. So as soon as I got my tax return, I spent everything into going to the course, travel, everything. And since then, I've never looked back.
Okay. Now, Andrew, could you explain to someone who doesn't quite understand exactly what it is you do, if you had to dumb it down to a fifth grade level, what it is that you do and who do you help?
So what I do predominantly is called fascial stretch therapy. And what fascial stretch therapy is gentle tractioning of the um, joints like legs, arms, and small circumductions. For little kids, it'd be like I would do small circles just to see where your body is tight and where you start to slow down. So, like a lot of the examples I give is you're laying down on my massage table and I'm lifting your leg up. And at some point, your nervous system is going to start shooting a message to your tissue saying, we're going to start slowing down over here. We're going to start feeling pain. So, so in order for the nervous system to be protected, or the nerves, the tissue and muscles start to like kind of tense up and lock up. So I feel that I can feel everything starting to slow down. And that's where I stop right before we start inducing pain. And then I gently move, sway, do small circles. So the body knows that it's safe for you to move. And then more often than not, you just start feeling the muscles and the tissues relax. And once everything relaxes and opens up, then I can give you that added motion or that extra, few inches of space to be able to move, to give you the extra flexibility.
Got it. Now, in what situations would someone want to seek out your services? Kind of mentioned before you've worked with athletes and professionals, people that want to get moving, but I guess what particular situation would someone want to seek you out and what you can do to help them?
It it really depends. People from all walks of life come to me. Um, but more often it's been people that are desk workers. They're in the office all day long. Their hips are getting stuck, which is causing back pain. They're hunching over from being on the keyboard. That's where I see it the most. People that don't move as much as they should because they're stuck in an office, all day long, 9, 10 hours a day,
Mhm.
and they don't give themselves that opportunity to move freely because, after work, they have family to take care of, or, whatever life brings. So normally that's what it is. It's, people that generally, don't move nearly as much, and their fascia starts to become a little bit more dense, and there's no movement for everything to just glide properly.
Got it. Now, is this a relatively new treatment, or would you say it's been around for a while, but just not a lot of people are aware that it even exists?
Not many people are aware of this. From what we know, the institute that I studied at, Stretch to Win, they've been doing this since the late 80s, early 90s.
Oh, wow.
Yeah, and they've treated like a wide range of people. The founders of Stretch to Win, they actually worked with the U.S. Olympic hockey team like back in the 90s. They treated NFL players, NBA players, famous people. Um, from what I know, Will Smith, Drake. There's a wide range of people that know about it,
Hmm.
but for some reason, just like the general population doesn't have um any idea of it.
Okay. And would you say that this field is evolving, and there's new treatments and new methodologies coming out in this space? If so, like, are there any that you're particularly excited about that's starting to come out or that's new?
So there's always a lot of studies with the fascia and stretching. There's a lot of doctors like Dr. Carla Steckel, Dr. Robert Schley, people that study the tissue, like Thomas Myers. That's their life's work, and they're constantly looking into how all these different modalities, especially stretching, affect the body and the tissue and the fascia. So there's a lot of studies coming out right now that says that, just how how you stretch and move, make your, I guess, extend your life.
Mm. Okay. So it's really about increasing the not only the length of your life, but also the quality of your life.
Yep.
Okay, got it. Now, Andrew, I want to dive a little bit down into your business specifically. I'd like to understand
Okay.
kind of what separates you, what differentiates you from other practices like yours in the industry. Is it that there's just not many people out there that's providing the kind of service that you provide? I'd also like you to kind of talk a little bit more about your personalized approach, how you're able to put yourself in the shoes of your patients. So, kind of what separates yourself from other people that offer something similar to what you do?
So what separates me from other businesses that, that do stretching is the personalized approach. Like me, like I put myself into their shoes because at one point I was them.
Mhm.
I know what it's like to walk around with pain, and it's something that's sometimes, a 24/7 thing, and you become sort of miserable and uncomfortable, and it changes how you act. So, I put myself in their shoes, and I'm like, okay, it's the sympathy, the empathy, um, that really draws people to that. Because a lot of times, there's other industries out there where it's like they don't really give them that little bit of, empathy or the sympathy that they want.
Mhm.
So, I start off with that, start off with, saying, okay, I know what it's like to be in your shoes. You do not deserve to be in pain or whatever it is that's going on. So let me modify the stretches so however you feel that it feels comfortable for you.
Mhm.
My stretches are not painful. At times they can be not painful, but they'll feel
Uncomfortable?
uncomfortable. Yes, that's the word I was looking for. So if it's uncomfortable, it's okay as long as you're not pushing back and saying ow ow ow. With the other mode, and then I also tend to throw in all the other services that I do, like, and it all just depends on what I feel is going on with the body at that present moment.
Mhm. Yeah, I think it's really important. I guess a lot of stories that I've heard is that the practitioner is actually was in that situation before where they had the pain, they had the situation, and because of that, it now led them into them helping other people
Yeah,
alleviate that pain or alleviate that issue that they were running into. So I
right.
think it's really important in a situation like yours where you understand like the pain points people are going through and that there is a better solution that where they don't need to take drugs or they don't need to get surgery or anything extensive like that. It's really just using the natural movements of your body in a way that
Yes,
heals you naturally, right?
yes, yes. Like they say, movement is medicine.
Mhm. Got it. Now, could you talk a little bit more about how your approach to educating your patients about what you do and the benefits? I'm sure you get some people that come to you and it's like, uh, I don't know what this stretch thing is. A friend told me about it. I read a little bit about it, but what is it? So how do you approach that education point? Do you find that a lot of people come to you and they already know what it is, or people come to you with pain and they just says, I need help. How can you fix me?
The majority of people do come like that. It's like, I found you online, just fix me. So when I do that, they're on the table and I'm explaining to them, okay, I ask them, do you know what fascia is? And more often than not, they say no. So I tell them, okay, so fascia is a collagen-based water protein that is like there's different layers of it within our skin. So then they'll look at me like, okay, what is that? So I was like, and it's like something it covers us from just below our skin all the way down to our cellular level. And if you can imagine Spider-Man's suit that you see all the webbing,
Mhm.
it, it's like that. We have it head to toe, but the webbing is like on a microscopic level. So it's like
Mhm.
very, very thin. And then I tell them also, it's like when you're cooking chicken, you're cutting it up and you want to peel that skin off with chicken. Once you peel the skin, if you see that clear film that's detaching off the chicken skin, that is their fascia.
Mhm.
So then that's when you see like the gears turning and the light turns on. They're like, okay, then they start to understand. So then, that's from the very basic stuff. And then, I start getting into explaining to them, you know, there's a lot of times where they start to like push back as I'm stretching them, or I feel a lot of like muscle twitch. So I tell them, a lot of it is, your nervous system, you're trying to protect, that injury. And, I have to make them feel comfortable during that movement. So sometimes, just a quick tap on the leg or like rubbing it just so the nervous system could get some type of input to know that it's not in danger. Then they're like, oh, okay. And then they relax. And then I can start giving them that movement. And then as I'm moving, they start to feel the relief immediately. And then they start feeling like the tension release from all different parts of their body as they're stopping that protection.
Got it. Now, I'm sure, Andrew, that you have a lot of people come to you with a lot of common misconceptions that they have about what you do and the treatments that you provide. Could you share a couple of common misconceptions that you hear quite a bit from your patients?
So the first one would be they need to feel pain when stretching.
Mm.
So because that's what's been ingrained in us. Oh, if you're not feeling any pain as you're stretching a certain body part, then you're not doing it right. And with the way that we were taught is no, if you're feeling pain, it's gonna trigger something in your nervous system to try and defend or protect that area. So that's the one that's the first misconception. And then the other misconception about the stretching is pain. So a lot like 90% of the time where people feel pain, it's actually not there. It's somewhere else within their body, but the pain is just a symptom of something else not working.
Mm-hmm.
So, for example, the most common example I'll give people is their back pain. Are like especially with office workers, they're sitting down for so many hours, and it starts maybe mid 30s, 40s, and you've heard it a lot. You're gonna stand up from your chair,
Mm-hmm.
and it's the oh my back, oh it's so tight.
Mm-hmm.
So I tell them, I'm like, it's not your back that's the problem. It's most likely your hips. Your hips are glued because your brain thinks that your hips want to be at the 90-degree position. So it starts thickening the fascia in your hips because it thinks that that's what you want to do. So then as you stand up, all that thick fascia in your hip area starts to pull on your back. So then they're like, oh, okay. So that's why I tell them 90% of the time, pain is a symptom and not the actual cause of whatever you're feeling.
Man, Andrew, after you say that, you're making me want to stand up and do this interview standing up. I feel bad now sitting down. I'm like, man, I've been sitting down all day long. I got to stand up now. Okay, so that I think that really helps a lot as far as because I think most people had that issues like there's the talk about sitting is the new smoking, but I mean that's
Yeah,
from a health perspective, but from a pain perspective, I think a lot of people don't realize that.
yeah,
And I'm not old, but I'm getting to that age where I can't just bounce back from everything. So like I sit most
yeah.
of the day and then just kind of randomly, like once a year, once every 2 years, I'll just get this intense pain somewhere either in like the hips or like the shoulder. And it's like, I think it's because I'm sitting too long. And so I think your point of people just sitting all day long and then it causes issues. That's why it's causing issues. And that's why your treatment can really help people in those situations.
Yes.
Okay. Now, I'm curious, Andrew, what role do you think that, because you mentioned that you do kind of like a personalized approach to everybody, everyone has a slightly different situation, different body type, etc.
Yeah.
So, how do you utilize creativity in your approach when you're dealing with any given patient? Like, what role do you think creativity plays in patient care?
It's, in my opinion, it's a huge role. Because from what I've noticed, our bodies are not mechanical. You don't move like robots. And it's not to, offend or disrespect, the, a lot of people out there, but they've been taught that our bodies are more mechanical, a muscle connects, it starts here, ends here. Then then another muscle group, starts here, ends here. So they're used to looking at us like robots, but our bodies are not like that. Our tissues, our fascia, everything is more of a 360-degree organism. So for us to just, treat everything, as mechanical, it doesn't work that way. So when I'm working on people, I'm not moving them, in angles. I'm looking for every little bit of degree of movement that I can get out of the person.
Mm.
So sometimes, I'll go up and then you'll see me twist a little bit and then move them off to the side because that's what their body needs. Some people, I can either, stretch them down and then off to another angle, but they're both feeling pain in the same spot. So it just really depends on how their tissue and fascia is restricted and what their body prefers to move like.
Got it. And that's really just, you're not going to know until you just get into it and you start stretching them and you find out.
Yeah,
It's like,
yeah,
oh, you're really stiff or stuck and or you're not too bad.
yeah, exactly.
Okay. Now, Andrew, I'm sure that you've come across some particularly challenging cases in your career. So, would you mind sharing a story of maybe one person that was just really, really tough case, or they came to you with a really extreme situation, and how you were able to get them a good outcome in the end?
Yeah. So when I first started, there was this older gentleman. He must have been in his mid to late 70s. He had right hip replacement, had osteoarthritis on his left hip, poor movement, poor movement. He was hunched over because he depended so much on his walking cane, and he would walk with his right arm using the cane, and then he would carry a bag on his left shoulder. So he was hunched over and then turned, and then this is how he would walk.
Mm.
So after I worked with him almost every weekend for about 2 years, and little by little, you can just see the improvement in his body. His posture started, getting corrected. He was standing more straight. His pain like decreased a lot. So by the end of the 2 years, he had lost roughly 40 pounds because he was moving and walking better.
Mm-hmm.
He was happier. Like you can just see it, that his whole demeanor was changed because your demeanor is not good when you're like this, and then once you see yourself, standing upright, and it's like, oh, okay, I look better. So by the end of those 2 years, like I said, yeah, lost the weight, and then he goes to me, Andrew, he goes, for the first time in, I don't know how long, I'm off of all my different painkillers. He's like, I was I was taking like roughly 10 different types of pills. He's like, but ever since I've come to you, I've had to decrease every single one of them. He's like, I was gonna do another hip replacement for my hip that has the osteoarthritis. He said, I don't even think I need it anymore.
That's incredible.
And it is, and it is. So that's probably the most, you know, the one story that has affected me the most is like I made a difference in his life. And obviously, there's been other people, but I mean, I think his has truly made an impact on me.
Yeah. I mean, I think it's just incredible. Just the power that you have at your fingertips is how you can change the trajectory of someone's life. I mean, if he
Mhm.
continued on all these drugs, if he did surgery, I mean, who knows how much that would have shortened his lifespan. Not only shortened
Yeah,
the length of his life, but also the quality of his life. I mean, taking 10 different pain medications, it's got to do something negative
yeah,
for you. Like
yeah,
you're not in a good place. So,
no.
I mean, it's just incredible that what you were able to do for him to really change things for him. So, with that being said, Andrew, I mean, where do you think that the future of, I'm going to call it stretch therapy, is going? I mean, it sounds like it's so transformational. So, but what do you think the future of it's going?
The future of it is, it's going to be big. It's actually, it's bigger now. There's a lot of franchises that have opened throughout the country. So, and there's all, there's different types of stretching methods, but everything is starting to spread, it's starting to get big. From what I read, like within the next few years, it's going to be like a multi-billion-dollar industry because
Wow.
people are noticing that, stretching and movement is getting people away from having to take, medicines like that one client that I had. So it's good because then, it's going to improve people's quality of life. It's going to extend their lives. The older generation, they can be around longer to move with their grandkids and, hopefully great grandkids. So, and that's where I see it going. It's going to expand, greatly within the next few years.
Okay, good to know. Good to know that it's going to be available to more and more people.
Yes.
So, Andrew, I have one last question for you, but before I ask it, I want to point people to your website at dyntherapy.com. Now, last question is, what do you think is the most important piece of advice you can give to someone who is experiencing some level of pain, but doesn't want to do surgery, doesn't want to go down the drug route? Where do they start their search? And when they do start searching, how do they figure out which provider or which person that they want to choose that's going to get them a good result?
The search online. There's a lot of people out there in each individual city that has, whatever it is that you feel you need. There's people like me that do cupping, there's cupping, stretching. There's so many different modalities out there that if you don't want to, go, the surgical route or the medicine route, there's so many different holistic services out there that people can search and and then just like any other service, it's do you like the person or not? Once you meet them, you can't always just stick to the first person that you see. There's always options out there for you, and just see what is your best fit. And I'm pretty sure that you will all find someone out there that can help you best. And if you feel that one person doesn't really you don't really like that route, then go search somewhere else.
Okay. Well, there you have it. Andrew sharing his expertise. So, Andrew, where can people contact you in your business?
I can be found on Instagram at Dynamic Stretch Therapy. I can also be contacted via email, dynamicstretchtherapy@gmail.com. And you can also shoot me a note on my website on DYN Therapy.
Okay.
And you can also reach me via phone, which is 808-630-3133.
Perfect. Well, Andrew, great having you here. Thank you for sharing your message.
Thank you, Daniel. I appreciate your time.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.